Welcome back. In this video, we're going to dive into the diagnostic criteria used to diagnose depression. Understanding the diagnostic criteria is crucial for recognizing depression and ensuring that those affected receive the appropriate treatment. Today, we'll focus on the ICD-10 criteria and the mhGAP diagnostic criteria. Let's begin with the ICD-10 criteria. The ICD-10, or International Classification of Diseases, 10th edition, is a widely used system for diagnosing mental health conditions, including depression. It provides a standardized set of criteria to ensure consistent diagnoses across different healthcare settings and countries. For a diagnosis of depression, the ICD-10 specifies that a person must meet at least 5 of the following symptoms for a period of 2 weeks or more. These symptoms should cause significant functional impairment in daily life. Let's go through the core symptoms of depression, as listed in the ICD-10. Depressed mood. This is the most common and noticeable symptom. The person feels persistently sad, empty, or hopeless. It's a deep, enduring sadness that isn't just a passing feeling, it's constant. Loss of interest or pleasure. The individual no longer finds joy in activities that they once enjoyed. This is called anhedonia and can be seen in a lack of interest in hobbies, socializing, or even personal care. Fatigue. Even after a full night of rest, people with depression often feel excessively tired. The fatigue is so overwhelming that it affects their ability to perform basic daily tasks. Sleep disturbances. Depression often causes insomnia, difficulty sleeping, or hypersomnia, sleeping too much. Both can contribute to the person feeling physically exhausted. Appetite or weight changes. Some individuals may lose their appetite, while others may overeat as a way to cope. Significant weight loss or gain is often noted during this period. Feelings of worthlessness or guilt. Individuals with depression often feel excessively guilty or believe they are worthless. They may blame themselves for situations beyond their control. Difficulty concentrating or making decisions. Depression can impair cognitive function, making it hard to focus, remember things, or make choices. Thoughts of death or suicide. In more severe cases, individuals with depression may experience suicidal thoughts or contemplate self-harm. In the ICD-10, to receive a diagnosis of depression, a person needs to have at least 5 of these symptoms, and they must be causing significant distress or difficulty in functioning. Reflection questions. Why do you think it's important to have clear, standardized diagnostic criteria for depression? How might the symptoms of depression affect someone's ability to perform in their everyday life? Now let's take a look at the mhGAP diagnostic criteria. The mhGAP Mental Health Gap Action Program is an initiative from the World Health Organization, WHO, aimed at improving mental health care in low-resource settings. The mhGAP diagnostic criteria are simplified to make it easier for healthcare providers in resource-limited settings to diagnose and treat mental health conditions, including depression. In the mhGAP guidelines, depression is diagnosed based on the presence of core symptoms, but the criteria are more flexible and can be used in areas where mental health resources may be scarce. According to the mhGAP guidelines, for a diagnosis of depression, the person must have 2 main symptoms: depressed mood or loss of interest in activities that once brought enjoyment. This is similar to the core symptom of the ICD-10. At least 2 additional symptoms must be present, including fatigue, changes in appetite, sleep disturbances, or feelings of worthlessness. The mhGAP guidelines acknowledge that some symptoms may be difficult to identify, so it focuses on the most obvious signs of depression. One key aspect of the mhGAP criteria is its emphasis on functional impairment, the inability to perform daily tasks because of depression. This helps ensure that the diagnosis isn't made based on temporary emotional distress, but rather on a serious, ongoing issue that's significantly affecting the person's life. The mhGAP criteria also recognize that depression may be accompanied by physical complaints, especially in regions where physical health is often more immediately prioritized. So symptoms like chronic pain, stomach issues, or headaches are often included as indicators in low-resource settings. Reflection questions. How does the simplicity of the mhGAP criteria help in diagnosing depression in low-resource settings? Why might the mhGAP focus more on functional impairment and physical complaints, especially in non-Western cultures? The role of functional impairment in diagnosis. Both the ICD-10 and mhGAP diagnostic criteria emphasize the importance of functional impairment. This refers to how depression affects a person's ability to carry out normal activities, whether it's at work, in school, at home, or in social situations. For example, someone with depression may find it difficult to get out of bed and go to work, may neglect personal hygiene, or may avoid social interactions. These changes in behavior are an important indicator that depression is interfering with daily life, and they can help distinguish between temporary sadness and clinical depression. Reflection questions. How might functional impairment help differentiate depression from temporary sadness or stress? In what ways do you think depression impacts a person's social life or workplace performance? Duration of symptoms. One final point to consider in both the ICD-10 and mhGAP criteria is the duration of symptoms. For a depression diagnosis, the symptoms must be present for at least 2 weeks. This helps ensure that depression isn't just a short-term response to stress or loss, but rather a longer-lasting condition that requires intervention. Reflection questions. Why do you think the 2-week duration is a key criterion for diagnosing depression? How might this duration differ for people experiencing depression due to specific life events, like grief or trauma? To summarize, depression is diagnosed using a set of standardized criteria that helps healthcare providers accurately assess the severity of the condition. The ICD-10 provides detailed criteria, while the mhGAP guidelines simplify the process for low-resource settings. Both criteria emphasize functional impairment and the duration of symptoms to ensure that the depression is significant and long-lasting. In the next video, we'll dive deeper into functional impairment, exploring how depression impacts personal care, relationships, work, and social life. Let's keep it going, and I'll see you in the next one.